In New Zealand, 1 in 4 women will have their labour induced. There are lots of reasons for this. This video is not about when or if labour should be induced. It's about how induction of labour is undertaken, and it's a brief introduction to the OBLIGE trial.
The OBLIGE trial is a study comparing 2 common methods of induction of labour. The first is a prostaglandin hormone preparation inserted during a vaginal examination. Prostaglandin hormone can sometimes cause contractions, so monitoring with a heart rate monitor is required. You will need to stay in hospital. The second method is a balloon catheter fed through the cervix during a vaginal examination. It's a thin tube with a small balloon which mechanically and gently stretches the cervix. Contractions are less likely with a balloon catheter, and therefore monitoring is not usually required. You will spend as much time as possible at home, usually the first 18 to 24 hours of your induction. Both methods are safe and effective, and both are commonly used. In the OBLIGE trial, we're interested in knowing which method is more likely to lead to a vaginal birth, which is most cost-effective, and which method women prefer. We also want to ensure that both methods are equally safe. That's why we're undertaking a trial.
In the OBLIGE trial, women who wish to participate are randomized. This means you have an equal chance of being in either group and cannot choose which group to be in. We're comparing having a prostaglandin induction and staying in hospital with having a balloon catheter induction and going home. You will come to the hospital and have a vaginal examination on the day of the induction. You will then be randomized and told which group you are in. If you're randomized to the balloon group, you have the catheter inserted and will be monitored for about half an hour. Then you'll go home for the next 18 to 24 hours unless your midwife or doctor has concerns about you or the baby. Women in the prostaglandin group have the prostaglandin inserted and then stay in the hospital. If you are having prostaglandin gel, more than 1 dose may be required. Women in both groups will be reviewed the following day. The next step in induction of labour is to break the waters around the baby to start labour contractions.
We need 1,550 women to take part in the study to answer these important questions about how to best induce labour. It will be one of the largest investigations of induction of labour ever undertaken.
We are asking some very important questions.
We'd love your help answering them.